Hey everyone. Hi, I'm Julie from Integra Health and Wellness, and we're going to get started tonight with stress, hormones, and health. And if you're just logging on, I'm really excited to meet you. Can you tell me your name? Tell me where you're from. We have people from all over the valley, all over the state, actually, that I get to partner with for their health and wellness journey. And I'm really excited to get to talk with you tonight, get better acquainted, and have us have this time of participation. So participate with me in the chat box. Tonight, moderating the chat box is Drea, and she's the practice coordinator for Integra Health and Wellness, and you'll get to know her too as we're walking you through this journey of getting you on to optimizing your health and your wellness and getting you back to where you want to be. So I'm looking forward to us starting, and what we're going to do tonight is we're going to be talking about stress, hormones, and health. And does anybody have any of that in your life, right? And so it's so important that as we're talking about these things that we're going to be able to share openly, and just remember, whatever we don't bring to the surface, we're not able to address. And so that's really important to us here at Integra, as we love to partner with you. I'm going to be sharing my slides with you. And so tonight, as we're getting started, you can get to know a little bit more about me, what I do. Nurse practitioner, functional medicine, we're all about root cause, helping your body get to that place that it's not going to be in your way anymore. It's going to be working for you and not against you. And so that's really what we're all about here in Integra Health and Wellness. Stress, hormones, and health. So tell me in the chat box, I see a group of you are in there. Tell me what brings you to this talk tonight. Are you dealing with anything? Anyone dealing with chronic fatigue? Anyone dealing with hormone imbalance? Tell me about what you're here to address. I'd love to have that conversation because it really is about you and where you're at with your health. So tell me a little bit about that. And I'll be telling you about why I got into this journey. Thank you so much, Kylie. I'm sorry you're facing those things. As we talk about hormones, we'll be talking about the effect of GI, hormones, and how that all works together. So when you're thinking about your health and your wellness journey, how many of you are where you want your health to be? Is anybody here on this call already optimized, ready to rock and roll? You're fulfilling your purposes in your life. You're feeling great. And I'm seeing that people are saying, not so much, right? Not so much right now. And I know for me, I had my own wellness crisis, actually. And so I want to go ahead and talk with you a little bit about that, because in the early 2000s, I was in really good shape. I had decided I was going to really focus on my health. So I started eating better and I started exercising. My kids were pretty young at that time, so they were really busy. And at that time, I was not working. I was spending my time devoted to raising my kids and with my husband. And at that time, I got into cycling. And so I was really excited because it was a new form of exercise. I was with some friends and we were able to do a lot. I was able to just hop on and be energetic and be able to do all of that. But what ended up happening was a few weeks into that, my health started to give me some warning signals, and I started to get GI symptoms. I started having bloating. I started getting more fatigued. I didn't have the stamina that I once had. And so I was really confused because I thought I was doing everything right. So I started doubling down my efforts. I was eating better. I was working out still. I was just trying to do all the right things. But instead of me getting better, my health just started to shift down, started to decline. And so what ended up happening for me was I started getting really confused because my hair started to fall out. I started to lose weight. And always before that, weight was more of a challenge for me to kind of keep in a balance. But then at that time, I couldn't even continue to cycle. So I ended up having to drop that hobby just so I could try to be there for my family. But even at that point, I was starting to have to miss my kids' events because my fatigue had gotten so bad. And so I started to really get worried. I had a fear of having ovarian cancer, to be honest, and I hadn't told anybody that I had that fear. I hadn't even shared it with my husband. But one of my aunts had died when she was really young from ovarian cancer, and I had some of these same symptoms. So I was secretly worried about it. So I started seeing all the normal, specialists and all the different doctors, and I was in the middle of getting all of that evaluated, and just really worried. I felt really depressed. I was isolated. You should have seen my house. It was, before I used to keep it spotless, and I just wasn't able to keep up because my energy was so lacking. I could just barely get by, for the day. And anyway, around that time, my one of my brothers is an ER doctor, and he lives down in the Southern California area, and so he hadn't been up in this area for a while, and he happened to come by to see us. And when he knocked on the door and I opened it, and he literally just took a step back because of how I looked, so emaciated. And he said what I had secretly been fearing, that, Julie, do I need to worry about you? Do you have cancer? And we talked, and I told him about where I was at and my whole evaluation. And a couple of weeks later, I got the results, and lo and behold, I was fine. I did not have cancer. I was fine. They didn't have an answer, but I didn't have something that was life-threatening. So of course I was relieved, and at the same time, they were still telling me to do the exact same things I had already been doing. You just need to eat well, sleep well, you need to exercise. And so, as you can imagine, I was just extremely just lost, puzzled, frustrated, because I still was no better. I was just nowhere. So a couple weeks later, I had already registered for a pharmacology conference. So I attended that, was in the Bay Area, and I was introduced by a mutual colleague to a functional medicine practitioner. And I started working with her, and that's the means by which I started to regain my health. I started to find out the root cause and the issues that I was facing, and that's the journey that I had. And so this is what drives me, what motivates me and gives me so much reward and passion, is to tell you that you have the opportunity to shift your health, to get back on track, to be able to have a different future than what you might be imagining right now, and something that you want to live for, a health status that supports the life that you want to live, instead of wondering what your future is really like. So that's really what my purpose is really to come alongside someone like you, so that we can optimize your health, find out what's blocking you, get you to that place of vibrancy, of resiliency, and vitality, getting back to that energetic person you are. So let's start to talk a little bit more about the details of where we're at. Where are we going in our life, and how are we going to get there? So part of us developing something that can be usable for you is me putting together ultimately my dream team here. So you can see Drea, she's right under me in that picture, and you can see the rest of our team, and we have health coaches, and we have other practitioners, we have natural estheticians. So we're doing a lot of really cool things for inside, outside, really to help optimize where you're at with your health. So I want to tell you a little bit more about one of our practice members, and that is a gal named Patty. And so Patty said we could share her lovely story. And so Patty was much like many of you, talking about your fatigue, talking about she was at the point in her life where she had developed a few diagnoses. She actually had diabetes. She was on 15 different medications. She had started to gain weight, and it was really stubborn and hard for her to get it off. And she was just at the point of just being fed up. She was just tired of going down the route of seeing all of her regular doctors who just wanted to keep adding on more and more medications. And she wanted to be done with it. And Patty was much like you. She heard about me through a mutual friend. She hopped on a webinar. We got to know each other, and she did what I'm going to ask many of you to do, and that is she signed up for a complete wellness evaluation. And she brought her husband, Joe. I'm going to ask you also to bring your spouse. And when you do come with your spouse, one of the reasons I have them come is because it's so important that as we step forward together on your wellness journey, that you have the support of those who are closest to you. You have the support of the people who live with you and who do life with you, who you respect, and who you want to, come alongside you. So she and Joe came, and when Joe came, they came right here into this very room, in the exam room where I'm at right now. And when Joe came, he kind of had his body language of like, not sure. He's a little protective of Patty. He wanted to make sure that this was legit, that the things that we were discussing really were possible for Patty to accomplish. So during that time, we had a great, authentic conversation. It's really important to me that we have this partnership of integrity. And so when we finished that conversation, she was ready, and Joe was ready to support her as well. So she signed up. We got her set up for her personalized program, her approach, and we'll talk about that during the rest of this talk. And so a year later, fast forward, and where Patty's at right now is she was able to lose over 50 pounds. She was able to get back to doing some really fun things. She loves participating in helping with different equine therapy groups in the Valley. And so she came right around when this picture was taken a few weeks ago. She was really excited because she was able to help partner with this equine therapy group and raise some amazing funds so that kids who have gone through trauma could get their life back. And so Patty's now, really vibrant. She's walking with Joe. She's like I said, she's off all these medications. She was able to get off 10 different medications in her first year. And now we're on the process of helping her get off of her diabetes medications. And so that's where she's at in her journey. So it's super exciting to watch a person just like you getting control of your health and being able to shift your future and get back to what you want to do. And maybe you're going to be like Patty, and maybe you're going to be like one of my other people that we partnered with, just like these folks here. So men, women, people of all ages. I see kids. I see people right now. Our current tribe is about ages 3 to 91, and maybe you fit into that group, right? And so what we're going to cover for the rest of our talk tonight is how did we get here? Like, why are we struggling here in our healthcare when we're spending so much money and so many resources? We're going to talk about that underlying cause, and we're going to talk about how you can take action so that you can shift your health. So tonight is for you if you're feeling exhausted or overwhelmed, if you're feeling not so good, you're not feeling the way that you can and that you want to, and maybe you realize, hey, health doesn't come in a bottle. I know I'm never going to get to my health by taking more pills, and you do want to take some ownership for your health. I was super frustrated. I have seen people be frustrated as practitioners. You might be frustrated with your own health journey. And this is about you being able to shift away from being the person whose future ends them up in a hospital setting or in a rest home or somewhere else that you don't want in your future. And this is about you being able to take control of where you want that to head. And the sooner you do take control of that, then the better you're going to be. So what about this picture? So will you participate with me in the chat box? Is this common to see someone taking multiple medications? Do you guys think that this is common or uncommon? Anyone have a thought for us on that? 5 medications, right? Okay, some people are saying not only is it common, but it's common for you, right? What about if this lady was in her 30s? Do you guys think that's common? Do you guys see that happening around you? Yes, unfortunately, right? So all the way down, we're seeing 10-year-olds have chronic adult-like diseases, and things have really shifted. Even though we're spending trillions of dollars annually, most of it is on chronic health conditions that can be reversed and made better through diet and lifestyle choices, through things that we're going to talk about tonight. And even though we're spending all of that, look at how low America is ranked among all these developed nations. Even despite all these resources, they are not getting us where we want to be. So maybe many of you were like me with some bowel difficulty. Maybe you're feeling tired and sluggish, depressed, feeling isolated. Maybe you're not sleeping well. Maybe it's affecting your mood. Maybe your emotions are taking a hit in this. Maybe your metabolism is taking a hit, either too much, too little, kind of getting off track in that way. And so I have a question for you. When you think about our current healthcare model, right, which is what it's called, would you say that it's getting us further to our health goals? Is it really getting us to that optimized place? Do you guys think, do you have confidence in it? Do you trust it? Do you want to have the future that this current health model is offering to us, right? No. And I think it takes us finally realizing that system is set up to manage sickness, not get us to wellness. It's a completely opposite goal system. And so really, we started to understand that during the beginning of the COVID crisis, right? We understood, hey, something's terribly wrong here. We have a lot of inflammation. We're not even able to handle certain infections. Things are overwhelming us, and we really have to do something about it. So I want to tell you another story about Tasha. So Tasha is in her 40s, and she's a patient here with us, and she came because she had suffered from COVID, and she had all these long haul symptoms. She had heart issues, her energy was low, she wasn't able to hang out with her husband after work. She was just barely able to make it through her day. Then she'd just crash on the couch and just call it quits, because that's all she could, manage, was just to do that. She used to love to work out. She wasn't able to get up and do that. She has some young adult kids and kids in high school, and she just was barely able to meet, up with them and keep up with what they were all about. And so what happened with Tasha was we started working together. And as you can see from her story here on the screen, she was super excited because she realized so many of her health goals and what her vision of what she wanted her health to be, even within the first 3 months. And so we all celebrated with her, which we'll celebrate with you too when you start to meet your destination, if you will. And she was able to start understanding, hey, I can get back to being active. She started being able to work out. She started being able to meet up with friends after work, have a full day like how we really want to live, and just have so much more flexibility in her life. And so that, I just want you to understand, that could be you. That could be you. And so when we think about all the things in life, right, we have this opportunity for our mindset. We can put our mindset on the things that we can't control, but we also have the choice to put our mindset on the things that we can control. And when you think about the things that you can control, right, what can we control? We can control what we put into our mouths. We can control how we're doing with our activity. We can control what things we're exposed to, at least to the degree that we know of. And we can start to make those kinds of choices to begin to shift that into a better place. So the reason why patients that we work with get these kinds of results is because we don't skip any steps. We put together programs specific to you, designed around these pillars of health. And you see those here. So we'll be talking about these pillars of health because they're critical for you to get to the changes that you want, instead of where, we've been in the past, and where, dealing with types of stress and dealing with types of toxicities. So let's talk a little bit about types of stress. Anybody have stress here, right? Just a little, in this life. So we can have different types of stress. So think about that. Let's talk about physical stress. Because you can be like me, where you can do exercise, and for a while it's okay, and it's a good kind of stress because it's actually making you stronger, or it can overcome you depending on where you're at with your health care and your health journey. Maybe you've gotten into a car accident, right? That's a overwhelming type of physical stress. We'll come to the other side. What about emotional stress, right? Work-related stress, relational stress, stress around deadlines, and all of this really affects us, because think about this: your thoughts are your physical chemical reactions. They are those transmitting messages. They're telling our bodies all of these type of messages. And then what about chemical stress? So you may have heard that when researchers have tested unborn babies' blood, they have been able to find over 200 toxic chemicals that they're exposed to, even in moms who are trying to be as careful as possible. And that just gives us a little inkling of how many toxic chemicals we are dealing with all the time. And so it's something that we have to be diligent about. So let's switch and talk about hormones. Hormones are so important. And as you know, some can be fat burning, some can be fat storing, and we want to promote the balance so that our bodies know exactly what we need to do. So check out this list. Does any of you have these types of issues? Anybody dealing with vitamin D insufficiency? Anyone dealing with blood sugar instability? Anybody dealing with gut infections? Anyone been told they have some liver issues or fatty liver? Okay, I'm seeing everyone talk all about this. What about food sensitivities? Are you guys noticing that? Anyone having some changes with some brain fog? All of these things are telling us that our bodies need a reboot. We have to restart them and get to a better situation. So when we're thinking about, does insurance support this type of thinking of us getting out of the sick care model and into a wellness mindset, we can read something right here that blew my mind the first time I saw it. And that's this quote from Medicare. It's in the Medicare Journal, and it says, "Care that seeks to prevent disease, promote health, prolong and enhance the quality of life is not considered medically necessary and therefore is not payable." And it's just unbelievable that our Medicare system, which, by the way, dictates all of our insurance coverage, is so clear about what their goals are. And I want to ask you, is this your goal? Is this your goal to just manage your sick patterns? Is this your goal to do that? Or is your goal in opposition to what Medicare wants for you? This is how it feels. It feels like our model currently is tipped over. It's just upside down. And so the question is, what are we going to do about it? Are we going to wait till legislation fixes all this? Do we have time to wait for that? How long has it taken, right? Is it doing it for us? And really, it starts to get me frustrated, because I know that I've lived long enough to understand so far it's not happening. It's just not happening. So what am I going to do about it? And you want to think about this, because as you're thinking about your future, I want you to think about your why. So what is your why? Maybe you guys can put this in your chat box. I would love for you to do that. Talk to me about who is going to benefit from you transforming your health besides you, right? Right? Your sweet babies, right? So right in the middle, that's me and my husband, Mark. On the right, that's my son and his family, my 2 grandbabies. Maybe you're like some people on the other side of this slide. You're wanting to play games, hang out with the people you love, get together with people. Maybe you have other hopes and dreams. Maybe you're wanting to go ahead and get to the point where you are wanting to travel. Maybe you're wanting to just regain your confidence, right? Kind of have a little sass come back so you can walk into the room with a big smile, knowing you feel great, you're ready to participate. And so sometimes when I start asking this of people, I do hear people say, hey, it's a little scary to start hoping for that again. And maybe that's where you're at, you know? And so I just want to tell you, you can do it. You can do it. And we can walk you through a process that's set up for you to succeed. So let's talk about what that is. Let's talk about nutrition and detox and hormones and movement and fitness and mentoring and how it all comes together. So how many of you have heard of that statement, food is medicine, right? Anybody heard this before? Food is medicine, because, right, food is all about giving your body not just the building blocks, but the messages that you want it to have so that it will operate for you and give you the outcome that you want. So kind of what you put in, it is absolutely going to be what you put out. And when you're thinking about detoxification, so this is not about a bowel cleanse. This is not about being in the restroom all the time. This is about transforming these toxins, things we make inside of us, things that we are exposed to, and getting them out of your body able to deal with them and able to move on. So who needs detoxification? Do you think all of us are maybe exposed to so many chemicals? And it makes a huge difference in your body's ability to handle things. Because think about this, around your digestive system lives about 70% of your immune system. And when we have all of these toxicities and things blocking, causing inflammation, we're going to have the downstream effects. Our liver's not going to work well, our kidneys, our skin's not going to look as vibrant. Besides, we may have gut symptoms, but a lot of my patients come to me, they don't have gut symptoms, and yet their gut dysfunction is really apparent once we do some testing and uncover that. So it's incredibly important to get to the bottom of that, start dealing with that. Now, fitness is important too, but remember this, that we have to do that at your pace. And that's what's really important. We can't outpace where your body's at. And this is my team doing all different types of things. And that's what you'll be doing too, is things that are appropriate for where you're at in your wellness journey and getting you back on track. So let's talk about hormones a little bit more. Think about how body type is. It gives us a little clue as to what kinds of imbalances we're seeing, but we never want to just go from that. We want to test, and that's really important here for us at Integra. We test, we don't guess. We want to make sure that we're not just accepting something that's in a now widened range that's considered acceptable. So about 50 years ago, the major lab companies started widening out what they considered to be normal. And now we know that they did that because the population of America was starting to decline. Our health was starting to decline. So we're seeing all these ranges, and they, instead of saying, hey, something's wrong, let's fix it, they just accommodated for that and made that be okay. And so that's what many of you will see too. But when we do your testing, we're going to narrow it down, find out what's optimal for you, and get you set up on that path. So think about your symptoms, and this tree is a great example. So when you think about the symptoms that you guys have been putting in the chat box for me, you're talking about PCOS, you're talking about fatigue, you're talking about depression, and all these things. These are leaves that are on your tree. But what we're going to be doing is we're going to start healing the roots down at the base so that your body can start to rebuild itself and start to self-heal and get out of that path. So I want to tell you a little bit about Lisa. I'm going to go ahead and share a video of her story. And so let me grab that real quick and have you take a peek at that. So hi, Lisa.
Hi.
You completed a year, right?
Did it? Yep. Yes, I did.
So try to remember back. What were you hoping to accomplish, and how are you feeling?
Well, I was hoping to accomplish a few things. Number one, I couldn't get my weight under control for the life of me. I was exercising regularly and eating healthy, and felt like I was doing all the right things, but nothing was working. I felt like my hormones were all out of whack. My body was I was in pain a lot. You know, I couldn't be on my feet for very long because everything would hurt. And so I knew I needed almost like a reset. I knew my body needed a reset. So that's why I sought you out.
So tell us about what you've accomplished.
So number one, I feel just so much better. I feel, I lost almost 30 pounds, and I learned that my healthy eating, I learned more about that. Like I could be healthier. And the whys behind some of the changes that I've made. I'm the kind of person that, like, I'm going to stick to whatever is good for me, and I'm pretty stubborn as far as that goes. So, when I learned about different kinds of foods that were better for me, not necessarily low fat, but high healthy fat, my mind just switched, and it became like I understood it. Like, oh, this is what's good for me. It's not no fat, it's good fat. And so it got to the point, even on vacations, I would take my own food with me because I knew that I was still, on my regimen. I was not going to waver. So, yeah, it's been good.
You were committed.
I was committed. I was 100%. Still am.
Yeah,
Still am.
to your health.
Yes, absolutely. Yep.
Yes. Well, we just are just celebrating with you, and it's
Thank
been
you.
such a delight to work with you. Congratulations.
Thank you.
Awesome. And so maybe you are much like Lisa, and you know that you're not right where you want your health to be, and you know you can do it. And so it's all about coming to us here. Let's dig down deep. We're going to offer a discovery call in a few minutes. Drea's going to just put that up there real quick for you so you can see about getting your calendar out and us starting that process of developing that working relationship so we can get to know each other. Because mentoring and walking you through that process is absolutely critical. We want to get your respect and permission so that we can coach you through changes that are set up for you. And that's what we're going to do. So that's all about me and my team. And it's so important. Think about anyone who is able to actually make changes in their life. Almost all of them get a coach. And that's what you need too, is you need a coach. Because think about it. Can we leave out any of these pillars of health? Can we not have nutrition, for instance? Or could we not have fitness? Could we not move and still get to our health goals? Could we also not have our balanced hormones? Are there really any of these that we could effectively do without or ignore and still reach your health goals? So that's what's super important. And what we do here is we develop a personalized approach for you so that we can dive deep, find out what the dysfunctions and the blocks are in your health journey, and put together what the path, the blueprint, the strategy that you're going to need so that you will have a system you can put into play. You'll know exactly what to do, and you'll be able to get to that destination that you have in your mind. I want you to be thinking about that destination and what you're wanting to put together for your future instead of perhaps the future that you're thinking you might be willing to sacrifice or be satisfied for. So when we think about where you're at with your health, maybe it's time to switch that. Just use that as a jumping off point so that you can shift and get to that place of health and wellness that you know you want to be at. And what we do here at Integra is we're going to be not just telling you about it. We want real partners. We want people who are as committed as Lisa is to your health. And then we're going to show you how to do it. We're going to involve you. We're going to teach you. We're going to train you and walk you through that entire process. And how many of us have wanted to say, let me think about it. I have this wedding coming up. I think I'm going to do it after that. And then you think about life. How many weddings are you going to have for the rest of your life to go through, right? A lot. How many, maybe you're going to say, you know what, I have a graduation I need to focus on. But how many graduations are we going to have in our future? And really it comes down to that point in time where we're thinking, are the stars going to align? Am I going to get to that place where I want, where everything's going to be perfect and it's going to be the time for me? But instead, maybe it's all about your desire. When are you going to prioritize yourself? When is it time for you to say, enough is enough. This is unacceptable. It's time for me to get back my health, get back to where I want to be. So this is a picture of Eric, and Eric is 61 years old. And when he came to us, his health was just not doing very well. He was dealing with a lot of GI symptoms. He had a lot of inflammation. He had some joint pain. And he just was not feeling very, very good at all. And for him, and everyone's different. So far you've heard about Lisa, and you've heard about Tasha, you heard about Patty, and now you're hearing about Eric. And for Eric, his transformation was actually really fast. And he started realizing incredible changes, even in just a short 3 weeks. And then maintaining that has been really exciting to watch Eric just put this lifestyle into play and be able to get control of his health. And maybe that's you too. So really my question is it your chance to change? Is it your time to change? Is it time for you to prioritize your health so that you can stop cutting corners maybe? Or giving yourself the excuse, if you will, and maybe this is like this guy. Hopefully this guy only did this one day, but I think sometimes we get into a pattern where we want to start doing these kinds of things that are going to eventually undermine our health. So it's about you getting back your health, getting back to where you want to be. And so really, what's next? So what's next is we like to meet you, and Dre is going to put this calendar link up there on the screen for you. And what I'd like for you to do is everyone pull out your calendar, see what works for you. I'd love to meet with you. And what we do is during this 15-minute complimentary call is I get to know where you're at with your health. I'm going to start understanding what's blocking your health, what's happening for you, and what's happening with your health that we can start to shift. And at that call, we're going to offer you to come for a complete wellness evaluation. And this is a consultation. And during this consultation time, you're going to prepare. I'm going to send out to you a group of questionnaires because I need to get to know you deeply and thoroughly. I need to have a comprehensive understanding of things you've already been through, how you got to the place you're at. And I'm going to ask you things you probably haven't been asked before. You know, things like, when was the last time you were well? What has caused this journey? What have you noticed has led to this? We're going to spend an hour together, and I'm going to ask you to bring your life partner, your spouse, your significant other, so that the three of us can have a one-on-one conversation, get down to the bottom of what's going on with your health, and start that process of putting together what it's going to take for you to shift your health. So what we do here is we offer it typically for $287, but for those of you who are on this webinar, we do offer that at a discount. And so that appointment is $87. And if your spouse wants to have their own consultation, then that will be $47 for them. If they're coming but they're not having a consultation for them, of course there's no fee for them. It will just be us talking about where you're at with your health. And during that time, we're going to get clarity. We're going to be understanding what your destination looks like so we can celebrate with you. We're going to make sure you have your questions answered, put together your particular program so that we can walk you through and launch that in a successful manner and get you moving toward the destination that you have picked out for yourself. So it really is all about you. And I just wanted to tell you about a few other facts and questions that tend to come up in this journey. And so many times people ask me, do you take insurance? And as you can imagine, insurance covers pills, covers procedures, and really things that we hope that you never need. And so it definitely has its place, but it doesn't promote the health and wellness, the vitality, the resiliency, the things that you're wanting to get back with your life. And so when insurance comes into play, then the next question is it affordable? And I can tell you we have practice members from all different walks of life. We have people who are on state disability. We have people who own multiple businesses. We have people from all different, from being retired, different budgetary constraints. And we're able to work with anyone as long as it's your mindset to shift your health and really be about the change that you're wanting to make. And so don't let that stop you. Let's have a conversation and get to the bottom of what it's going to take for your health to shift. And during that time too, many people ask, can I help everyone? And I think you can understand that no one can help everyone, and I'm the same way. But if I meet with you, if I invite you to have a complete wellness evaluation, it's because I have confidence that I'm highly likely able to help you. And I'm not about offering for people to participate in a program if I don't have confidence that you're able to do it and to make great strides in your health. And then when we sit down, we'll be able to decide all of the details, and you'll be able to know all of the details of that. So tonight, this is about you. I hope I've given you lots to think about and lots to hope for so that you can get back your health. Dre is going to put up there, if it's not still up there, that offer for the discovery call. I want to give you an opportunity for us to meet together. So I'm looking forward to meeting with each of you, getting acquainted and getting you set up on your program, getting you back to your health and wellness, back to your vitality. And thanks so much for participating with me. I look forward to meeting you guys in the near future. Have a great night, everyone.